Welcome, dear students, to the next unit on molecular endocrinology. We were talking about hypothalamic and pituitary hormones, and today the session will be on hypo and hyperactivity of the pituitary glands. So, we'll talk into detail about some of the diseases that are caused due to both hypoactivity and hyperactivity of the pituitary glands. So in this figure, you can see that you have the growth hormone released from the pituitary. The growth hormone has both indirect actions and direct actions. In the indirect actions or the growth promoting actions, it acts on the liver and other tissues, produces what is called as insulin-like growth factors, which have an effect on the skeletal and the extraskeletal system. In direct actions, which are metabolic or anti-insulin actions, it has an effect on fat concentration, fat metabolism, and carbohydrate metabolism. So, in fat metabolism, it increases the breakdown and the release of the fat stores, whereas in carbohydrate metabolism, it increases the blood glucose levels and other anti-insulin effects. So, insulin-like growth factors produce a feedback inhibition of GHRH release as well as GH release. Growth hormone in itself produces a feedback inhibition of the GHRH and the GH release. So the anterior pituitary, the posterior pituitary, and both together. So the hyperactivity causes in anterior pituitary, the hyperactivity causes gigantism, acromegaly, acromegalic gigantism, Cushing's disease, whereas hypoactivity causes dwarfism, acromicria, Siemens disease. Posterior pituitary is called CADH or syndrome of inappropriate hypersecretion of ADH, and the most famous diabetes insipidus. When both the anterior and the posterior pituitary is involved, hyperactivity, the disease has not been characterized as of now. In hypoactivity, the disease is called as dystrophia adiposogenitalis. So we'll see each one. So gigantism or acromegaly. Both are in effect the same thing. Only thing, the affected population is different. So the overproduction of the growth hormone causes excessive growth, and in children, this condition is called as gigantism, whereas in adults it is called as acromegaly. So gigantism is an abnormally large growth due to excess growth hormones in childhood before the growth plates close. Whereas acromegaly is a chronic metabolic disorder in which there is too much hormone, that is growth hormone, and the body tissues will gradually start to enlarge. So gigantism causes are hyposecretion of GH in childhood or pre-adult conditions or stage of the person, and it's like a non-cancerous benign tumor of the pituitary gland. This is the most common cause of gigantism. Uh, it's also known as the Carney complex, McCune-Albright syndrome, multiple endocrine neoplasia type 1 or MEN1 neurofibromatosis. So these are the different factors that could be the causes of gigantism. So in this figure, you can see the cancellous bone, articular cartilage, you have the epiphyseal plate, and this is the degradation of the same. So symptoms of gigantism: delayed puberty, double vision or difficulty with sight vision, frontal bosic, prominent jaw, headache, increased sweating, irregular menstruation, large hands and feet with thick fingers and toes, release of breast milk, thickening of facial features, and weakness. So it can be diagnosed with the help of a CT or an MRI scan of the head for the pituitary tumor. Uh, Failure to suppress serum growth hormone levels after an oral glucose challenge, high prolactin levels, increased IGF-1 levels, and again any damage to the pituitary like decrease in other hormones are present like cortisol, estradiol, testosterone, thyroid hormone can also cause gigantism. So the treatment is medications which reduce the GH release, blocks the effect of GH, and prevents growth in stature. So the treatment that is given is dopamine agonist, which reduces GH release. GH antagonist blocks the effect of GH. Sex hormone therapy to inhibit the growth of the long bones. Somatostatin analogs to reduce GH release. Radiation of the pituitary gland to regulate the growth hormone. It is the least desirable option due to the limited effectiveness and side effects because your pituitary is like menacingly near to your brain, so it might affect any radiations can affect your normal process of thinking or thought. And finally, the treatment of choice is surgery to remove the pituitary tumor. So complications that can arise from gigantism includes delayed puberty, difficulty of functioning due to the unusual size and features, diminished vision or even total vision loss, embarrassments, isolation, difficulty in relationships and other social problems, hypothyroidism and severe chronic headaches, and as well as sleep apnea.